In the name of Allah, today I am going to discuss a very important case of benign versus malignant ovarian cysts. First of all, ovarian volume or size. The risk of malignancy increases with tumor size, regardless of morphology. The size of an ovarian follicle is between 15 and 25 mm. However, even between 30 and 40 mm, 68% of simple cysts were found to be functional. There is no borderline for malignant ovarian tumors regarding the size. However, there appears to be a general consensus that the likelihood of malignancy with a simple ovarian cyst of less than 5 cm is remote. Number 2, loculated cyst. The loculation of an ovarian cyst increase the risk of malignancy. Thin septation favor the benign lesion, whereas thick and vascular septa favor the malignancy of a lesion. Number 3, papillary excrescences. Papillary excrescences are localized or growth of epithelial lining of a cyst. The more the papillary excrescences, the greater the likelihood of malignancy. Papillary excrescences that don't protrude 3 mm into the cyst cavity are not strongly associated with malignancy. Number 4, focal solid area within an ovarian cyst are much larger and therefore sonographically distinct from papillary excrescences. Focal solid area also increase the likelihood of malignancy. Number 5, tincture of time. A follow-up ultrasound examination in 6 to 8 weeks will reduce the false positive rate of sonomorphology. Occasionally, hemorrhagic ovarian cyst will have a complex appearance that almost completely resolve in the interval between examination. From 75 to 95% of functional ovarian cysts in women of reproductive age resolve in 5 to 10 weeks. Even in postmenopausal women, 29% of simple ovarian cysts will disappear. Number 6, color Doppler has been used as an attempt to reduce the false positive rate of ovarian morphology. Growth of malignant tumor is dependent upon angiogenesis. These abnormal vessels lack smooth muscle in their wall, so on Doppler malignant growth will show low resistance with Phi of less than 0.1 and Ri of less than 0.4. Rather than utilizing a specific Ri and Phi cutoff for benign and malignant, the presence of absence of vascular flow and to specific region of a mass are evaluated. Flow within the mass, flow within a papillary excrescences, or flow along septation will be considered indicator of malignancy, while peripheral flow is more indicator of a benign fraud. We summarize all of the thing in one table. You can see size less than 5 cm, more than 5 cm, septation thin, avascular, thick, vascular, papillary excrescences absent and present, more than 3 mm, focal solid area absent and present, in time slow growing, rapid growing, in Doppler peripheral flow, in central flow.